Doctor, I have pain in my tailbone when I sit for a long time, or when I move from a horizontal to a vertical position, or for example, just when I sit for several hours, the pain in my tailbone becomes unbearable.
Hello everyone, I'm Yulia Golubeva, a sports doctor, rehabilitation specialist, and pelvic and respiratory therapist at Dynamica Clinic. And today we are going to talk about Coccygodynia, or tailbone pain. Why does the tailbone hurt? There can be several reasons. It could be an external cause. For example, if someone was skiing or snowboarding, fell on their buttocks and their tailbone started to hurt. It could also be an internal cause, for example, a traumatic childbirth in a woman, or for instance, an unsuccessful sexual experiment. And there can be other reasons. For example, an infection, an abscess, or a tumor can also cause pain in the tailbone. The first line of therapy for Coccygodynia is behavioral therapy. That means we adjust our daily activities in such a way that our tailbone doesn't hurt as much as possible. And in this video, I'll tell you about a few of the most important daily habits that I ask my patients to adopt in their lives when dealing with tailbone pain. So what can help relieve this problem? First of all, if a person sits for a long time in a curled up position like a shrimp with the pelvis tucked under, this is the worst possible position for someone with tailbone pain. Remember, if someone has tailbone pain, sitting like this on the tailbone is harmful. Why? Firstly, mechanical pressure on the tailbone irritates it, increasing pain. Secondly, when sitting in a shrimp-like position, there is compression of the tissue surrounding the tailbone. This can also cause pain and discomfort in that area. So how should you sit? You have your sit bones. Those are the little bones at the base of your pelvis. You sit on your sit bones, lean forward a little, just a bit if possible, and also spread your legs apart. And this position is the most optimal for people who have tailbone pain. The second recommendation is to use a special wedge-shaped cushion, as shown in the picture. Why exactly this kind of cushion and not just any cushion? A donut cushion, not just any soft surface. The thing is, when we sit on a wedge-shaped cushion, there is a special cutout for the tailbone. And our tailbone doesn't experience such a strong mechanical load. It doesn't get overloaded and it doesn't hurt. It is recommended to use this cushion for 6 to 8 weeks. But as practice shows, these time intervals can vary greatly depending on the severity of the patient's condition. Many of my patients complain that their tailbone pain gets worse during bowel movements, especially if the patient suffers from constipation. Therefore, the third recommendation is to use stool softeners or adjust your diet, at least during the rehabilitation period. That means add more fiber to your diet and adjust your drinking habits. To prevent constipation, adjust your bathroom habits. For example, use a footstool about 30 centimeters high under your feet. This helps to increase the anorectal angle and reduce the strain on the tailbone during bowel movements. Sometimes just this one action can significantly improve the situation. The symptoms get better and overall things improve. If your tailbone hurts, try not to sit on a hard surface for more than 2 hours. Try to stand up, walk, go up and down the stairs more often. And if you suddenly feel that your tailbone starts to hurt after walking for a long time, in that case, be sure to do stretching and relaxation exercises for the back of your thigh, your glutes, and your lower back. If the pain in your tailbone is related to your muscles, and that happens quite often, in this case, if you have an aggravation, you can, for example, take a warm bath or apply something warm either to the perineal area or to the tailbone area, and see how your symptoms will behave. If this problem is indeed related to the muscles, then most likely the symptoms will significantly decrease. Sometimes pain in the coccyx is associated with increased tone of the pelvic floor muscles. If this is the cause, you can try doing special exercises that are aimed at relaxing this muscle group. Up to 40% of women and up to 23% of men experience an increase in coccyx pain during sex. That's why during the rehabilitation period, I usually advise patients with Coccygodynia to choose positions that do not cause symptoms. It is also recommended to use lubricant in a larger amount than usual. If the previous recommendations don't work, you can simply take a break from sexual activity during the rehabilitation period. If you suffer from a problem like coccydynia or tailbone pain, of course you can use all the recommendations I mentioned in this video. And you can also consult, for example, a specialist like a pelvic therapist. We pelvic therapists work with the pelvic area, with the pelvic floor muscles, and in particular with the tailbone.